should be asked to speak on at this meeting, because after all, we were told when we went in, when the election was called, that both parties that are now in government, the Conservatives and the Liberals, said that one thing was completely clear, that there were going to be no cuts in NHS spending. And furthermore, both parties also said that there were going to be no major structural changes in the NHS. Now, the Condemn coalition lied, it's turned out, on both of these pledges. Both pledges are now in complete tatters. We now face the largest structural reorganisation that the NHS has ever faced, and many NHS staff already are preparing to reapply for their own jobs as that structural reorganisation takes place. David Nicholson, who is the Chief Executive of the NHS, has asked primary care trusts, who are the local health authorities in all the boroughs, to start looking to find billions of pounds of cash savings over the next 3 years. Figures of 10 to 20 billion have been proposed, and that compares to a £100 billion total NHS budget. Locally, what's being talked about is that 15% cuts at our local hospital, the Royal London Hospital, are being talked about amongst consultants. Figures are not yet confirmed, and that's 15% job cuts in both clinical and managerial staff. So I think it's worth looking back a little bit to see, to go back a teeny bit into the history of the NHS, which of course Labour founded at the end of the Second World War, as Bevan put it, so that poverty would not be a disability nor wealth an advantage. And it was incredibly popular. There was a mile-long queue to buy copies of the Beveridge report that outlined the benefits that the NHS and other welfare reforms. Can you imagine a queue outside Her Majesty's Stationery Office now to buy a copy of the reports on the reorganisation that's taking place? Even the Tories dared not oppose it. Churchill was enthusiastic, saying that there would be equal opportunities to benefit the best and most up-to-date medical services, he said. Disease must be attacked whether it occurs in the poorest or richest man or woman. That was Churchill. But the Tories have been out to privatise and cut the NHS ever since. And Thatcher's Tories tried to massively expand private health insurance, and now they're back to do the same again. Now, the main white paper changes are that the NHS is essentially going to be hived off into as an independent company, nationalised company, separate from ministerial control, with a very much slimmed down Department of Health, perhaps a fifth of its current size. So it will start operating exactly like a business, with an NHS management board no longer consisting of hospital administrators who have worked their way up through the banks, but with people who are, that was a slip of the tongue, work their way up through hospital administrators, but it's now going to be completely staffed by by bankers and people from industry who will come in to form the NHS management board. Public health will be moved right across to local authorities, and there will be a new provider landscape. Just listen to these words. We no longer have hospitals, but instead they're called providers, and there will be a new provider landscape, to use their word. So instead of NHS hospitals being what the last government called preferred providers, now any willing provider can compete for trade within the NHS. So private hospitals can set up, and if a primary care trust or a health authority tries to give a contract to treat patients to an NHS body without United Healthcare or these other corporations being allowed to compete, they will be brought before a regulation and competition body called Monitor, which will be a bit like Ofgem or Ofwat or any of these other bodies. So there are massive changes at the top of the NHS. Now, the new NHS Commissioning Board will be free, as the white paper puts it, from day-to-day political interference. It will be responsible for assessing the GP consortia which are going to be set up to replace primary care trusts locally. And all that will happen over the next 2 to 3 years. Now, these GP commissioning consortia will be responsible for 80% of the NHS budget, because primary care trusts will be abolished by 2013. So there will be nothing between the NHS National Executive, in a way, at the top, and the GP commissioning boards below it. And for GP practices, joining one of these commissioning consortia will be compulsory, and GP practices that refuse to do so will be allocated to one of these bodies and will stand to lose money if they don't join in and help with the aims and objectives. And then buried in there, it says that the government will not bail out commissioners who fail. So here we are as groups of GPs in Tower Hamlets having to buy operations, outpatient appointments, A&E attendances for the population of Tower Hamlets, and having to balance the books in between seeing patients. Now obviously we will have to buy in managerial support, and we are told we can buy that managerial support in from existing staff from the old primary care trusts who will have to reapply for their jobs with us, or from private industry, and already private organisations, Health Dialogue, United Healthcare and so on are vying for custom with the emerging GP consortia. So we were all from local authorities. So, and if we fail to balance our books, then the monitor, that overarching regulatory body, will come in, take away our commissioning rights and hand it over to other bodies like United Healthcare, and then we will be told that we failed and they can do the job better. So what is actually happening is, if this government had decided to privatise the NHS in one go, I think they would have completely, there would have been a popular uprising. But instead, what's happening is that they're handing money and power across to GPs, thinking they're popular with the public, with the expectation that with the declining health budgets, those bodies will fail to stay within budget, and then they can say, look, this particular GP commissioning group in Tower Hamlets is not balancing its books. You know, they're obviously failing, just as, say, Islington Education Authority had its schools taken away from it and handed over to a private company. The same will happen in the NHS. So that's on the sort of commissioning side, on the purchasing of healthcare side. Now on the provider side, hospitals, which are currently NHS trusts, will have to form themselves into foundation trusts, and that means that they will be allowed to, 2 minutes left, they will be allowed to borrow money from the City of London. So they will be able to speculate, to build and produce the same kind of housing bubble in health that occurred in the banks. And potentially those organisations can then go bust, and when they go bust, then again private management comes in and starts running those hospitals. So, and then the final icing on the cake is that we're also promised personal budgets. Now those of you that work in social services know what that means. That means that instead of a patient with diabetes having their care provided by the NHS, they're given the money, and they say, well, you can actually commission your own care personally from whichever healthcare provider you want, and if you're rich, you can top that up. And at the same time, hospitals are allowed to, the cap on private practice in hospitals is being taken off, so hospitals can do run any amount of private practice they want from within NHS hospitals. So I think that's a great danger. Now, I think this is the most significant NHS reform ever. GPs are being handed a poisoned chalice, but I think that actually there are very strong possibilities for fight back. Because with the last government, we saw privatisations occurring. For example, Barts in the London, just round the corner, is a private finance initiative hospital. It's owned by Skanska Innisfree, which is a private company. But that partial privatisation was occurring at a time of growth in NHS funding. What we're now seeing is that the privatisation will pick up pace at the same time as there are going to be cuts in NHS funding. And when you have a combination of cuts and privatisation, that's when I think that the public will start to see clearly what's happening, and we have the possibility for fight back. So I think, you know, health will be one of the key issues around which the anti-cuts campaign and the anti-privatisation campaign will be sought. And that's why we will be encouraging as many of our GPs and as many of our hospital workers as possible to join in the protest against Cameron's cuts outside the Tory party conference on Sunday the 3rd of October, and I think that's why we must all work together to build a united campaign in Tower Hamlets against cuts and privatisation. Thank you.